If you are currently experiencing shooting pains in your buttocks or down the back of your legs, and you're finding it difficult to walk, sit, stand for any period of time, then there is a good chance that you might be experiencing sciatica. So in today's video, I'm going to explain everything you need to know about what sciatica is, what causes it, and what exercises or stretches you can do to help relieve your pain. So the first thing is, what is sciatica? Well, sciatica is essentially irritation of the sciatic nerve. So the sciatic nerve starts in your lower back. So it starts from the last two nerves that come out of your lumbar spine. So the lumbar spine are the 5 bottom vertebrae of your spine. So it comes from the bottom 2 nerve roots. So you've got L4 and L5. And then it comes out from the top 3 of the sacral nerves. So S1, S2 and S3. They form together to create the sciatic nerve. So the sciatic nerve then comes out through this gap here and then down through your buttock, down the back of your leg, and then branches off at the knee. So there are 2 main areas that the sciatic nerve can get compressed or irritated. The first is in the lower back, so then around the lumbar spine, and then the second is through the buttocks. So I'm going to explain now how the lower back affects the sciatic nerve, and then we'll go on to how the buttocks affect the sciatic nerve. So let's just spend a minute looking at the lower back and how this can cause you sciatic pain. So as you can see, the nerves that come out of the lumbar spine come out through some little holes. These are called foramen or foramen, depending on how you want to pronounce it. If one of these holes becomes narrowed, then that can cause compression on the nerve. So this can happen if, let's say, the discs have become thinner, so the vertebrae become closer together. That would then make the holes slightly smaller. So this can happen if you've got history of disc bulges or disc prolapses. It could also happen as you get older because your discs become more dehydrated. So any narrowing or any thinning of the discs can cause narrowing of those foramen. Then we could also get what's called bony growth. So deposits of bone around the area, that can cause narrowing of those holes. If you have a look just here, these are called facet joints. Now, if any of these facet joints become compressed or irritated, that can cause inflammation. And as you can see, the facet joints are quite close to where the nerves come out. So any irritation of the facet joints can cause irritation of one of these nerve roots. Now, I know I'm showing you up here, and that's not technically where the sciatic nerve comes from, but it just this bone here gets in the way, so it's just easier to show you from up here. So the facet joints can become irritated, and that can cause inflammation of the nerves. So then we can have the actual discs themselves causing problems. Now, normally with a normal healthy disc, the center of the disc is made up of a gel-like substance. Around that are rings, a bit like layers of an onion. Now, if those layers become weakened through poor usage or poor body mechanics, then what can happen is that gel-like substance can end up bulging out through the back. It can be a bulge or a prolapse where the substance comes completely out. So any disc bulges, disc prolapses can cause direct compression on the nerves. But also, as a disc prolapses, it causes a lot of inflammation as well. So any inflammation caused from the discs can again cause you sciatic pain. So as I've already mentioned, the sciatic nerve is formed of the last 2 lumbar nerves and the top 3 sacral nerves. They form together to form the sciatic nerve, as I've wonderfully demonstrated here by some cable. The sciatic nerve then comes out of this sciatic notch and runs down the back of your leg. In relation to the second place that the sciatic nerve can become irritated, it can become compressed by a muscle called the piriformis, which I'll show you now. So here we have a model of the buttocks, or here we have a model of the hip and pelvis. This is the right side. So this is your femur, so this is your thigh bone. This muscle here is your gluteus maximus that's been cut away. So this is your bum cheek muscle that you would have about here. Underneath that, we've got the gluteus minimus and medius, which are again gluteal muscles, but they are more responsible for walking. This muscle here is called the piriformis. So if I take this away, you can see the piriformis comes from the underside of the sacrum, runs all the way along here and attaches onto the greater trochanter of the thigh bone. So this muscle helps to externally rotate your leg. So as you're standing and looking down at your foot, if you turn your foot all the way out or your thigh all the way out, the piriformis is one of those muscles that is responsible for that. So the sciatic nerve comes out of this gap here in the bone, and generally speaking underneath the piriformis muscle. So here we now have the sciatic nerve coming underneath the piriformis. In the majority of people, this is how the nerve would come out. So it would, generally speaking, come out underneath the piriformis muscle. What can happen is this can become spasmed, this piriformis muscle can become spasmed, and potentially that can cause compression of the sciatic nerve. Now, in some individuals, there is a genetic variation in how the sciatic nerve comes out in relation to the piriformis. In some people, the sciatic nerve might come out through the middle. In others, it might come out above and below, or above and through the middle, or below and through the middle. I'll put a picture up on the screen just here so you can see how the sciatic nerve can vary. But what can happen in some individuals is they may do something that causes a spasm or irritation of the muscles. And this irritation or inflammation that you would expect in the area would cause irritation of the nerve. And then that would cause you sciatic type symptoms as well. Now, when it comes to the risk factors involved with sciatica, you're generally more likely to get sciatica as you get older, if you're overweight, if you're unfit, if you're pregnant, or you have diabetes. And of course, this is not an exhaustive list of risk factors, but they tend to be the main ones involved. So how do you know if sciatica is coming from your lower back or your buttocks? Well, I'm going to show you some really simple tests that you can do right now. So the first thing we're going to look at is whether it's coming from your lower back. Now, if your sciatica is coming from a disc-related problem, then as you bend forwards, you would expect that disc bulge or disc prolapse to become slightly more exaggerated. So potentially flexion or forward bending in your spine could make that sciatic pain worse. So the first thing we're going to look at is called a slump test. So to do a slump test, what you need to do is sit on a chair, put your hands behind your back, drop your head down so your chin is towards your chest, and then try and bend at the spine as much as you can. If this causes an exaggeration of pain, then that is a positive result. So potentially that could be coming from a disc-related problem. Now, as I mentioned earlier, there's a possibility that you can also get facet joint compression or foraminal stenosis, which is the narrowing of the holes where the nerve roots come out. So if that is the case, then extension of your lower back would cause an aggravation of symptoms. So you could do this lying on your front and do like a Mackenzie style push-up, or just on the chair, you can arch yourself back as far as you can. And if when arching back you get an aggravation of symptoms, then that could be a positive, and that could represent the pain coming from the facet joints or compression somewhere within the joints. Now, if both of those tests are negative, so forward bending or backward bending don't cause you any worsening of symptoms, then the pain could be coming from your buttock. So all you would really need to do is find the greater trochanter, so that's the bony part, the outside of your thigh bone. From there, run your fingers backwards and start pressing into the muscle. If when you press, it's sensitive, and especially compared to the good side, then there's a good chance that there's irritation within the muscles in here. So there's a good chance that that could be causing your sciatic symptoms. Another thing you could do while sitting on a chair is bring your leg up on top of your knee, hold onto your knee and pull it up towards your opposite shoulder. This would cause a stretch within the piriformis and buttock muscles. So if there's any compression of the sciatic nerve through here, then that stretch would cause more compression of the sciatic nerve here. So that would cause you pain, and that could reflect that the pain is coming from your piriformis or one of your buttock muscles. So another way you can do this test is called the FAIR test, and that basically stands for flexion, abduction and internal rotation. So if you're testing this buttock as the cause of your sciatica, then lie on your side, bring your knee up, and then pull it down towards the floor. If that causes you an aggravation of symptoms, then again, that's a good chance that the sciatic pain that you're experiencing is coming from your buttock. So when it comes to treatments, what I want you to make sure you're doing is that you're keeping yourself moving. The more you can move, whether your pain is coming from your back or your buttocks, the more you move, the more you're going to get blood moving around those areas, the more you're going to get those muscles working, the less likely those muscles will stay spasmed. So it's really going to help to reduce inflammation. It's really going to help to reduce some of that spasm as well. So all you need to do is just go out, keep walking. I know it's going to be a bit painful, but the more you can just keep moving, the better the chances are it's going to help you. Obviously, don't go out for too long, don't walk for too long, because the more you walk, the more you might irritate those muscles or those nerves. The next thing you can do is hanging from a bar or hanging from a door frame. The reason this is good is because whether it's coming from your spine or from your buttocks, this is not going to cause you any problems, whether it's disc related, facet joint related, or muscle related. So all you're going to do is grab hold of a door frame or a pull-up bar, and you can get pull-up bars quite cheap from your local fitness store. Grab the bar and just drop your weight down. Keep your feet on the floor, but just allow your knees to soften and allow your spine to take some of that weight. My feet are still on the floor, so I'm supported and I'm not going to feel like I'm going to drop. But just hang there and let your spine just relax. This is going to help to cause traction through the spine. It's going to help to re-establish some of that thickness within the vertebra. If there's any joint compression, such as a facet joint compression or stenosis within the exits of the nerve roots, that's going to help to relieve some of that compression. So if you find that you can't be hanging from something because maybe you haven't got the strength in your hands or your arms, then that's no problem. You can use something like a chair with arms. So if you don't have a chair with arms, it doesn't matter either. You could get two chairs next to each other so you've got something to push against. But what you want to try and do is put your hands on the arms of your chair and lift yourself up. Once you get up here, you want to try and relax as much as you can. So just spend a bit of time, just breathe, just let the muscles in your back and your abdominals relax, and just let that weight pull your pelvis down so it gives you that traction through the spine. I would do about a minute on this. Now, if you can't do a minute all in one go, it doesn't matter. All you need to do is, as long as you can, so let's say 15 seconds, and then have a little rest, and then repeat. What I will just say is, as you start to reload yourself back into the chair, so as you go from here and put yourself down, just do that very slowly and very carefully, because you don't want to suddenly compress your spine and make anything worse. So next we have an exercise called the cat and cow from yoga. And I really like this exercise because it doesn't put much compression through your spine. So what you need to do is come onto the floor, get your knees underneath your hips and hands underneath your shoulders. And then from here, stick your bum out. So you're rounding your spine. You can look up as well. And then from here, you tuck your tailbone under. You try and bend or try and round your spine as much as you can and drop your head down. And you repeat as many times as you want. When you're starting this exercise, one thing to just make sure is you start very small. So very, very small movements. Just make sure that that's not causing you any pain in your back or down the back of your legs. And as you start to loosen up, then you can start to push the amount that you're going a little bit further each time. So this exercise will help to loosen up the muscles in your back and your hips, and it will help to get your spine moving and your spine looser. So if there's any restrictions within your spine or any tightness within the muscles, then this will help to loosen both of those. So the next exercise is called a Mackenzie press up. If you've decided that you're issue is coming from a disc or from a flexion that aggravates it, so it could be disc related, then this is going to really help you because it's doing the opposite movement. So what you do is you start off on your front, hands underneath your shoulders, and then just gently push yourself up so you're bending through the lower back. From here, just hold and breathe. It's really important to breathe. Breathing will help to relax those muscles. So just stay there for a while and just breathe. And then come down. And then you repeat. So you can come up a bit further if the last one felt okay. And over time, you can gradually push yourself up further and hold and just breathe. Personally, I would just hold rather than going up and down, because a repetitive movement, such as going up and down, could potentially irritate things further. So by holding this position or holding this position, you will just allow your body to relax and calm down, and you just stay there and breathe, and then reset whenever you need to. So you can do this, you can hold this for up to a minute or a couple of minutes. Find a nice comfortable position and just breathe. And this one is really good for disc-related sciatica. Now, if you have established that your pain is coming from your buttocks or possibly the piriformis, movement is one of the things that's going to really help to loosen that muscle up. So what I would suggest you do is get yourself something you can stand on, just a small step. Could be a pile of books or whatever. In my case, I've got a yoga block, so I'm just going to stand on that, and the affected side is going to be hanging off the side. All I want to do is just move. So I'm just going to move my hip and my thigh, and what I'm trying to do is get the muscles around the buttock and the hips working, because the more you can work those muscles, the more that's going to help encourage those muscles to loosen up and overcome any spasm. So I'm not going too aggressively. You can swing if you want to. Just be careful about swinging too far back and it causing too much extension through your back, and therefore maybe pinching something in your back. But you could swing, make sure it's controlled, or you can keep it more slow and just focus on contracting the muscles a bit more. If you do have pain in the buttock, then this could just cause you a little bit more pain initially, just while those muscles are starting to warm up. Eventually, because it's quite low impact, it should allow those muscles to ease. Make sure you're holding on to something so you're not going to fall over. But the more you can move, the more blood you're going to get through the muscles, and that's just going to help those muscles to relax. So I would do this for a period of time. I would work my way up to 1 minute. You could start off by just doing 20 seconds and then pause. If that feels okay, then you could do another 20 seconds and another 20 seconds. Once you get familiar with this exercise, then you can just go straight into doing 1 minute at a time. And this could be done as many times throughout the day as you like. Because it's low impact, because it's not putting too much strain through the muscles, you won't overdo it perhaps. All I would say is just don't do too long all in one go. So no more than 1 minute at a time. Sometimes when the piriformis is affected, it is in spasm. Now, if you try and stretch it too much, then that could potentially cause more pain. So it's worth trying to just shorten that muscle passively. So you're not trying to contract it, but you're just shortening it by putting it in a position where it's short. That can help the muscle to relax. So let's say it's this side that's affected. I would lie down on my back and then drop, or it doesn't matter what you do with this leg so much, but I would drop this leg down and out to the side. You can experiment with different positions. So you can have it as almost straight and just drop your knee out to the side, or slightly more bent. Find a position that works for you and just hold it in that position. Now, because you're not doing anything, because you're not putting a stretch on the muscle, you could potentially hold this for as long as you want, as long as comfortable. If it starts causing you pain, then you just stop. But potentially you could hold this for a minute, 2 minutes, 5 minutes, 10 minutes, whatever works for you. Play around with it and experiment and see what works. Then if you want to stretch that piriformis muscle, what you could do is bring your foot or your ankle onto the other leg, and then slowly start bringing this foot, the other foot, up towards your buttock. The more you bring your foot in, the more you start getting a stretch. Now, in this position, it's not really stretching. What you could do is grab your knee and you can bring it across towards the other shoulder. So this will directly stretch the piriformis. You could hold this for 20 seconds, build it up to 60 seconds over time. And you could do this 1 to 3 times in any one go. If you then want to do a slightly different variation, you could bring this knee up towards you and hold on to your thigh and pull that knee in. So this is kind of a modified pigeon pose, which you'd get in yoga. If you can't grab this leg, what you could do is put a towel or a belt or a band or something behind this thigh so you could hold on to it. But you grab that thigh and pull it up towards you and just hold. So you don't want to be stretching into pain. You want that pain to be enough so that you can feel it doing something, but not so much that you feel like it's going to make the piriformis pain worse. So hold that for about 20 seconds and build that up over time to about 60 seconds. And again, you could do this a few times in one setting, but just don't do too much in one go, because potentially you could make that more inflamed again. Now, when it comes to other treatment methods, you could try hot or cold packs. If you feel like your buttocks or your sciatic nerve or your back is really inflamed and sore, then you could try applying cold packs. The cold will help to reduce any inflammation and blood to the area. My advice would be don't do it for any longer than 10 to 15 minutes at a time, because the last thing you want to do is restrict blood flow to the area, because although you're getting rid of the inflammation, you're also restricting other normal healthy blood coming to the area to help to repair. So you could try cold packs. Or if your buttocks or your back or the area is feeling just generally tight, but you're not feeling so inflamed, then you could try hot packs, and this is going to help to relax the muscle. But again, you don't want to be doing this for too long, so no more than about 15 minutes. Because the heat will bring blood to the area, which is good because one, it helps to bring new, fresh, healthy blood and nutrients to the area, but also that heat helps to relax the muscles. But because it's bringing blood to the area, it also brings inflammation with it as well. So potentially, if you're leaving the hot pack on for too long, you could also make your inflammation slightly worse. So again, hot packs could be useful, but only for about 10 to 15 minutes. Now, another thing you could try is over-the-counter anti-inflammatories. Now, I'm not prescribing this to you, so please don't go out and start taking that based on my suggestion. But anti-inflammatories can temporarily help to reduce the inflammation in the area. So it's a good thing to try and use for the short term, but a bad thing to use in the long term, because inflammation is an essential part of the healing process. So if you suppress inflammation for too long, potentially you could slow down the repair process. Now, when it comes to taking medications, speak to a pharmacist or speak to your doctor just to make sure that you're taking the right medications. Now, if hot or cold, stretching and medications do not work, then the next option could be to speak to your doctor regarding something like a steroid injection or even surgery. Now, surgery sounds quite extreme, but it depends on what's causing your sciatica. If there is some form of bony compression within your spine, say spinal stenosis or arthritis, or even a spondylolisthesis, potentially you might need a surgical intervention to take that pressure off of the nerves. And as far as steroids go, steroid injections are again anti-inflammatory or help to suppress that inflammatory response. So that could potentially be useful for you if over-the-counter medications haven't worked. So hopefully now you understand what's causing your sciatica. Now, bear in mind, there are loads of different stretches that you can do for sciatica. What you need to do is figure out which ones work best for you. You don't have to do a whole load of them all in one go. Pick the best 2 or 3 that works for you and just stick with them for a while. So hopefully by now you understand what could be causing your sciatica. As you've seen, there are many different reasons that could cause sciatica, and probably several that I haven't even mentioned today as well. But what I want you to do is go away and try those exercises, try those stretches, and then in the comment section below, let me know which one you have found the most useful. So until the next video, stay safe and I will see you soon.